Good afternoon. You are listening to 100.9 The Cross. I'm Mark Hunter, and as you know, we have been talking to some of the staff and faculty at Robinson Community College. Today is no different. Maybe you've considered a career in respiratory therapy. With the recent pandemic, respiratory therapists are in high demand and are greatly needed in area hospitals as well as care facilities. Did you know you can get your degree in this field at Robinson Community College? Well, you can. And joining me to talk about this today is Kelli Heustess. And Kelli is the Respiratory Therapy Program Director. I've also got Danyelle Miray, the Clinical Coordinator for the Respiratory Therapy Program at RCC. And let's say good afternoon. How are you?
I'm doing fine. My name is Kelli Heustess, Program Director here at Robinson Community College.
As we begin, Kelli, could you tell us what is respiratory therapy?
Respiratory therapy is a field where respiratory therapists treat diseases, disorders, and viruses that impact the respiratory system, which could include asthma, pulmonary disorders, bronchitis, spinal muscular dystrophy, cystic fibrosis, and Parkinson's disease.
What types of jobs are available to those who complete the respiratory therapy program at Robinson Community College?
Graduates from the Respiratory Therapy program here at RCC can be employed at hospitals, clinicals, nursing homes, in the areas of industry and education, and even home care. During the time in the 2 years that they're here in the program, students will master patient assessment, life support, management, and even drug administration. We really try and push our students to go above and beyond and not to settle for just passing a course, but to really become one of the best providers they can possibly be for their patients.
I'm talking with Kelli Heustess and Danyelle Miray this afternoon from Robinson Community College. They're with the Respiratory Therapy Department at RCC. And how long does the program take to complete, and will those who take the class be certified?
Yes, it takes approximately 2 years, actually 21 months, to complete the program. Our class sizes are small, so you can get one-on-one time with instructors, and we have a lot of opportunities for hands-on training in the lab space that we have here on campus, as well as opportunities to gain real-world experience in the clinical setting. And yes, on completion of the program, they will actually be certified.
Now, for this next question, I'd like for you both to answer, what is the greatest joy in overseeing this program at Robinson Community College?
The most joy to me, and this is Kelli Heustess once again, the most joy to me is probably meeting first-generation college students and watching them progress through the program and rejoicing with the student and family when the program is complete at our pinning ceremonies and graduation.
My role as the clinical educator, this is Danyelle. It is great to see families coming from low income to financial security, and then also seeing the product that we put out being an active and integral part of the healthcare system in our own community.
Well, I'm talking with Kelli Heustess and Danyelle Miray this afternoon from Robinson Community College. And recently, the Respiratory Therapy Program at RCC achieved a 100% pass rate on the National Board of Respiratory Care, an entry-level examination to become registered respiratory therapists. Please tell us more about this.
Yes, this achievement shows the high standards that we set academically here at Robinson Community College in the classroom and through our partnerships with our clinical sites to prepare students for the workforce. The achievement of 100% pass rate also demonstrates that all of our students worked hard to earn this advanced level credential. Some graduates have completed their 4-year degrees at the university system, which opens up more advanced opportunities for respiratory therapy. There is also on the horizon an advanced level practitioner program that respiratory therapists will be able to participate in the future that basically result in a mid-level provider, which is very similar or equivalent to like a nurse practitioner, but specific to our respiratory therapy field. And this is currently under review for accreditation.
All right. In 2022, Robinson Community College's respiratory therapy students placed first in a statewide competition called the First Annual Respiratory Wipeout Competition. Could you please tell us more about this competition?
The competition took our students through various scenarios and had them build on patient care. They pretty much had it down to a science. They knew exactly what steps to take and what was to happen next, to where their timing was on point and they didn't miss a beat. RCC was one of 6 schools in North Carolina to participate in the event, which was sponsored by North Carolina Society for Respiratory Care, and it was held at the state meeting. And then the event was given over to high-fidelity simulators using physicians at the bedside, nurses at the bedside, and the students were given multiple facets of information and had to make clinical decisions based off of that. This is a new form of the competition that we've also participated in for years previously, which was based on knowledge, facts, and students from our school have also won that level of competition yearly.
This afternoon, I'm talking with Kelli Heustess and Danyelle Miray from Robinson Community College in the Respiratory Therapy Department, and I'm sure that there are success stories in this department at Robinson Community College. Would you care to tell us about some of these success stories?
Yes, one graduate that comes to mind is a disabled veteran that had served in the United States Marine Corps. After leaving the service, he discovered a passion for healthcare. He enrolled in our program, passed the board exam, and found employment at a hospital in Florida where he relocated back to Florida so he could be closer to his family. He hopes to one day be able to help other disabled veterans through discovering how respiratory therapy paired with holistic methods can improve their quality of life. This is just one example of how our program is making a difference, not just on a local level, but throughout the community. Another success story that I have in mind is we have a couple of graduates. One has become a CEO of a local hospital, and several of our graduates have moved up from supervisor level to manager level and even to director level at community hospitals.
I'm Mark Hunter. You're listening to 100.9 The Cross. And if someone listening is interested in maybe pursuing a degree in respiratory therapy, what would they need to do? Who would they need to contact?
Well, first steps will be to come out to the college and complete an application for admission to the program and to the college, and then schedule an appointment to meet with one of our health science advisors, and they will go through all of the prerequisite classes that are needed, help them with financial aid, and get them in contact with either the program director or myself, the clinical director, so that we can give them more personalized attention. And then once acceptance happens, we start off immediately in the fall every year, and students can be on their way to getting their degree.
Very good. Well, as we wrap things up this afternoon, is there anything else you'd like to say?
I just thank you for the opportunity, for allowing us to share a little bit about our program and about our passion for respiratory therapy.
Well, thank you for your time. I've been talking with Kelli Heustess, the program director, and also to Danyelle Miray, the clinical coordinator, both in the Respiratory Therapy Department at Robinson Community College. And I hope you have a great afternoon.